blood thicker than normal, increasing clot risk. Major surgeries, especially hip or knee operations, increase DVT risk. Pregnancy increases pressure in pelvic veins and changes clotting factors. Hormonal contraceptives may slightly increase clot risk in some women. Extra weight puts pressure on veins, slowing blood return. Smoking damages blood vessels and increases clot formation. Certain cancers and treatments raise clotting tendency. Pain or tenderness in one leg, especially the calf, may be a warning sign. Sudden swelling in one leg should never be ignored. The affected area may feel warm and look red. Sometimes DVT has no symptoms at all until complications occur. Sudden shortness of breath, chest pain, or coughing blood may signal pulmonary embolism, a medical emergency. Doctors use ultrasound scans to detect clots in deep veins. A dimer blood test may help detect abnormal clotting activity. Doctors prescribe anticoagulants, commonly called blood thinners, to prevent the clot from growing. In severe cases, clot-dissolving medicines or procedures may be needed. Compression stockings improve blood flow and reduce swelling. During long flights, stand up, stretch, and walk every hour. Simple ankle circles and calf stretches keep blood flowing. Drink water. Dehydration makes blood thicker. Maintain healthy weight, avoid smoking, and stay active. If you're high risk, doctors may prescribe preventive blood thinners before surgery or long travel. Deep vein thrombosis is preventable. Move more. Stay aware. Act early, because one long flight shouldn't become a lifelong problem. The heart works non-stop to keep us alive. But when the heart muscle becomes inflamed, it can struggle to do its job. This condition is called myocarditis. Myocarditis is inflammation of the heart muscle, known as the myocardium. This inflammation weakens the heart's ability to pump blood. The myocardium contracts with every heartbeat, pushing blood to the lungs and the rest of the body. When inflamed, the heart muscle may not pump efficiently, leading to serious complications. Myocarditis is most commonly caused by infections, especially viral infections. Viruses such as flu viruses, COVID-19, and other common viruses can trigger myocarditis. Sometimes myocarditis develops days or weeks after a viral illness. Certain bacterial infections can also inflame the heart muscle, though this is less common. In autoimmune conditions, the body's immune system mistakenly attacks the heart muscle. Some medications, illegal drugs, or toxins can damage heart cells and cause inflammation. Myocarditis can affect anyone, children, young adults, and even healthy individuals. Early symptoms may include fatigue, fever, body aches, and weakness. Chest pain is a common symptom and may feel similar to a heart attack. Shortness of breath during activity or rest may indicate the heart is struggling. Inflammation can disturb electrical signals, causing irregular heartbeats or palpitations. Fainting, swelling of legs, or sudden collapse are medical emergencies. Chest pain or breathing problems after an infection should never be ignored. Doctors begin by taking a medical history and performing a physical examination. Blood tests help detect heart damage and signs of infection or inflammation. An electrocardiogram checks the heart's electrical activity. An echocardiogram shows how well the heart is pumping blood. A cardiac MRI can clearly show inflammation in the heart muscle. Moderate to severe cases require hospital care and close monitoring. Doctors use medications to reduce inflammation and support heart function. If heart failure develops, special drugs help the heart pump more effectively. Medications or devices may be used to control dangerous heart rhythms. In rare cases, mechanical support or heart transplantation may be needed. Rest is essential. Most patients recover fully with proper treatment. Prevent infections, practice good hygiene, and avoid intense exercise during illness. Myocarditis is serious but treatable. Early diagnosis saves lives. Protect your heart. Listen to the warning signs.
What if a tiny germ could infect your heart? Endocarditis is a serious infection that can silently damage one of your body's most vital organs. Endocarditis is an infection of the inner lining of the heart, called the endocardium. It often affects the heart valves. The endocardium is the smooth inner layer that allows blood to flow easily through the heart chambers. When bacteria attach to heart valves, they form clumps called vegetations, damaging valves and disrupting blood flow. Endocarditis usually happens when bacteria enter the bloodstream and travel to the heart. Common causes include bacteria like Staphylococcus and Streptococcus species. Germs may enter during dental procedures, surgeries, skin infections, or through unsterile needles. People with artificial heart valves, congenital heart defects, or previous endocarditis are at higher risk. Using contaminated needles greatly increases the risk of infection reaching the heart. Early symptoms may include fever, chills, fatigue, and muscle aches. Shortness of breath, chest pain, and heart murmurs may develop as valves become damaged. Tiny red or purple spots on the skin or under fingernails can be warning signs. If untreated, infection can spread, causing stroke, organ damage, or heart failure. Persistent fever with heart disease history. Seek medical attention immediately. Doctors begin with medical history and physical examination. Blood cultures help identify the exact bacteria causing the infection. An echocardiogram uses ultrasound to detect infected growths on valves. Treatment usually requires several weeks of intravenous antibiotics in the hospital. Doctors choose antibiotics based on the specific bacteria identified. Patients are closely monitored to ensure infection is clearing. If valves are severely damaged, heart surgery may be necessary. Surgery can repair or replace damaged heart valves. Recovery may take weeks, but early treatment greatly improves survival. Good oral hygiene reduces bacteria entering the bloodstream. Regular dental visits are especially important for high-risk patients. Some high-risk patients may need preventive antibiotics before dental procedures. Always ensure sterile techniques during injections and medical treatments. Never share needles. It dramatically increases infection risk. People with heart conditions should maintain regular cardiology follow-ups. Endocarditis is serious, but preventable and treatable when caught early. Protect your heart. Seek care if symptoms appear.
Some deadly problems grow quietly. One of them is an aortic aneurysm. The aorta is the body's largest artery. It carries blood from the heart to the body. An aneurysm happens when it weakens and balloons out. The artery wall becomes thin and fragile. If it bursts, it can be life-threatening. A rupture causes severe internal bleeding. Often, there are no symptoms. That's why it's called a silent killer. Some may feel chest, back, or abdominal pain. The most common cause is artery damage. Hardening of arteries weakens the aorta. High blood pressure strains artery walls. Smoking greatly increases the risk. Risk increases with age and family history. Yes, risk can be reduced. Control blood pressure. Quit smoking completely. Eat a heart-healthy diet. Stay active and maintain healthy weight. Doctors use imaging tests. Scans can spot aneurysms early. Treatment depends on size and growth. Small aneurysms are monitored with medicines. Regular scans track changes. Large aneurysms may need surgery. Doctors may repair it with a graft or stent. Finding it early prevents rupture. Get checked. Protect your aorta. Save your life.
Do you experience leg pain when you walk? It could be peripheral artery disease or PAD. PAD is a common circulatory problem where narrowed arteries reduce blood flow to your limbs, most commonly your legs. This narrowing is caused by atherosclerosis, a buildup of fatty plaque in the arteries. It's like a clogged pipe. What causes PAD? Several factors contribute. Smoking is a major culprit, significantly increasing your risk. High blood pressure also damages artery walls over time. Diabetes can accelerate artery hardening and narrowing. High cholesterol levels contribute to plaque formation. Obesity and lack of physical activity are also risk factors. The good news? PAD is largely preventable. Regular exercise, even just walking, can improve circulation. A balanced diet, low in saturated fats and cholesterol, is crucial. Quitting smoking is the single most impactful step. Managing conditions like high blood pressure and diabetes is vital. If diagnosed, doctors have several treatment approaches. Lifestyle changes are always the first recommendation. Medications can help manage symptoms and prevent blood clots. Procedures like angioplasty can open blocked arteries. A small mesh tube, called a stent, might be placed. In severe cases, bypass surgery may be performed to reroute blood flow. Let's revisit that common symptom, leg pain while walking. This is called claudication. It occurs because your leg muscles aren't getting enough blood flow during activity. The pain typically eases with rest. It often feels like cramping, aching, or fatigue in the calves, thighs, or buttocks. Don't ignore this symptom. If you experience leg pain while walking, especially if it's persistent, consult your doctor. Early diagnosis and treatment can prevent serious complications. Take care of your arteries, they'll take care of you.
Your heart works non-stop. Let's protect it. What is coronary artery disease? It happens when heart arteries get narrow. Fat and cholesterol build up called plaque. Blood flow to the heart slows down. This causes chest pain and angina, sometimes no symptoms at all. Unhealthy diet, smoking damages arteries, lack of physical activity, high blood pressure and diabetes. Chronic stress, family history matters. Eat fruits, veggies, whole grains. Exercise 30 minutes daily. Quit smoking today. Manage stress. Control blood pressure and sugar. Regular health checkups. Medicines reduce pain and cholesterol. Blood thinners prevent clots. Tests show blocked arteries. Angioplasty opens narrowed vessels. Stents keep arteries open. Bypass surgery in severe cases. Blocked arteries can lead to heart attack. Chest pain, don't ignore it. Early treatment saves lives. Healthy habits protect your heart. Care for your heart, every beat matters.
This condition is called cardiomyopathy. Cardiomyopathy is a disease of the heart muscle. The heart becomes weak or stiff. It can't pump blood properly. Shortness of breath, swelling of legs and ankles. Extreme tiredness, dizziness or fainting. Genetic or family history. Long-term high blood pressure, previous heart attacks. alcohol or drug abuse, viral infections. Eat a heart-healthy diet, exercise regularly. Avoid smoking and alcohol, control blood pressure and diabetes. Doctors assess heart function. Medicines help the heart pump better. They reduce fluid and strain. Some patients need devices or surgery. Regular follow-up is vital. Cardiomyopathy is manageable if caught early.
Heart racing or skipping beats. This could be arrhythmia. What is arrhythmia? Arrhythmia means an irregular heartbeat. It may be too fast, too slow, or uneven, palpitations or fluttering, dizziness or lightheadedness, shortness of breath, weakness or tiredness. Sometimes, no